So now let us discuss the reasons and the details behind why you are short, and if you're short, will you able to gain your height later or not. So before going into the explanation of that, you'll need to understand two kind of terminologies. First is the chronological age and second is the bone age. So what is chronological age? It is the amount of time that is spent from your birth to the present. So that is according to the birth certificate. So like if I ask you what is your age, if you say 20, so that is your chronological age. So now what is bone age? Bone age is the degree of a person's skeletal development. In a child, the bone age serves a measure of the maturity and helps to diagnose the bone or the growth abnormalities. So because of that, you can find out if you can grow into a few inches or not. So let us discuss the details. So, to know that if you are able to grow a few inches in height in the future, you have to compare your chronological age with your bone age. So, first, the chronological ages are easy. You know your age, right? So, but you don't know your bone age. So, for that, you have to do an x ray. From that, you will get two types of situations. Number one is that bone age is less than chronological age, and the second situation will be that the bone age is equal to chronological age. So, what do they mean? So, the first is that the bone age is less than chronological age. So, if your child has this type of situation while you plot it on the growth chart, you will get two types of curves. First is the normal curve, and the second is the abnormal curve. If your child has a normal curve, it means that your child has a constitutional delay or that he or she is a late bloomer. We will discuss that later in the video, but in short, it means that your child has the capacity to grow into a few inches in height later in the future. And if your child has an abnormal curve, it means that he or she has some kind of chronic illness or nutritional or endocrine problem, which is the reason why he or she has short height. And if you treat that, he or she will grow into a few inches later in the future, depending upon the disease. Now, the second, that the bone age is equal to the chronological age. So, if your child has this type of situation, you have to plot it again into the growth chart to get a curve that is a normal curve or an abnormal curve. A normal curve means that your child has familial short stature, meaning that he or she is short just like any other family member, and he or she won't be able to grow into a few inches in height later in the future. And but if your child has an abnormal curve, it means that he is genetically or she is genetically short, and that he or she has taken a gene from either of the parent for being short. Now, the details of the constitutional delay or the late bloomers. So, to find out that or to identify that your child has the constitutional delay or he or she is a late bloomer, you need to remember these three pointers. Number first is that both the parents are of normal or average height. Number second is that they have the history of the late growth spurt, or they are late bloomers, or they have this factor running in their family. And the number third is that your child has bone age less than chronological age. So to find out the number third, you need to have an x-ray that will tell you the bone age of your child. And for chronological age, you just need to know the birth date of your child. For example, if he is 20 years old, it means that that is his chronological age. Now the graph related to the constitutional delay. So on the x-axis there is age, and on the y-axis there is height. Now to have a normal height, your child should have his curves plotted in between the 97th percentile and the 3rd percentile. 3rd percentile is the lower limit and 97th percentile is the upper limit, and 50th percentile is its average. Now your child, being a constitutional delay patient, will have his growth chart plotted below the 3rd percentile, that is why he is very short heighted. So you can see that it is a parallel curve at first, but after a certain age, for example at puberty, he has a growth spurt, and you can see the upward going curve above towards the 50th percentile, and then it crosses from the 50th percentile above it. This shows a growth spurt. So now if your child has this growth spurt, there is no treatment for that. You just have to wait for this growth spurt period. So that's all for today. If you have any queries, you can ask them in the comment section, and I'll get back to you.